I came to social work quite late. Used to be a pub manager, and then I had children. And I worked in a social care sector, but as non-qualified, I worked in domestic abuse in children's centres. And then I went to train as a social worker, and got my first job as a qualified social worker in Devon Partnership Trust, working in the drug and alcohol service. I was an assigned social worker, so employed by the local authority and assigned into the NHS Trust. I worked as a ward social worker, and after about 2 years, the ward manager she left, and there was a vacancy. And it had occurred to me that a social worker could really, really challenge the institutional discourse. So I spoke to a few people and I applied for the job. I think there was a fairly avant-garde interview panel. So they told me that they wanted to recruit me, but we had to have some conversations with the director of nursing for the trust, who miraculously agreed. And I was seconded from the local authority into a ward manager post. I managed 2 wards. Social workers have been assigned into trusts that haven't really understood the local authority remit. Local authorities haven't really understood the NHS structures and discourses. So we've had a history of mental health social work being confused and not belonging. In Devon, we've worked out new ways of doing things. We have carved out for our assigned social workers a place of defined activity and ownership of task that has real value to the key tasks of the NHS. And we've spent a considerable amount of time illustrating that to the NHS organisation. So now, within every business development planning meeting, within every risk meeting, within every trust committee, there is social work, social care representation, because they have begun to understand that actually it is intrinsic to their task. It's not something that sits and belongs elsewhere and may occasionally come alongside them. I'm absolutely passionate about social equality and social justice. And I think within mental health services, particularly the route I've taken through forensic mental health, there are people who have multiple oppressions, multiple challenges, and are not always at the top of the priority list. There's something about social workers listening to what people want. So having social workers working alongside people who wield power and challenging that on behalf of the population is a really important thing to happen. One of the things that I really value about my trust is that I have been very loud and very challenging throughout my career with them. And they chose to put me in a senior position where I had more power to be loud and to challenge them. And so even with the frustrations of NHS structures and government funding, it feels useful to know that actually they support having the challenge made. The Care Act had focused everybody's minds nicely, and suddenly the local authorities had gone, "You're not doing it, you're not doing it." And when I came into post, the local authorities told me that they were being shortchanged, and the health agencies told me that they were subsidising social care. And from what I could see, nobody was really actually doing any social care or social work. So we have developed a social work model which absolutely meets the requirements of the Care Act and has been audited as being compliant. But our social workers have been trained to understand the Care Act in terms of their core skills and strengths and assets-based practice and solution-focused therapeutic techniques.